I'm pleased to introduce Sarah Wilson, one of two dietitians here at Gleaners and nutrition manager for a variety of programs that are a big part of why we've made huge progress here in recent years. So Sarah, welcome.
Thank you, John.
I know there are many opportunities and many programs that we do sometimes as Gleaners, sometimes in partnership. We really have seen a lot of activity at that convergence of hunger and health. Mm-hmm. And what would you want to tell our downstream partners, but also the neighbors we serve, about the importance of hunger and health and why that nutritious variety of food is important?
Absolutely. Just in what we've learned from the neighbors that we serve and in working in partnership with a lot of healthcare providers and other community partners, we've really come to understand how much food insecurity and chronic health conditions go hand in hand. So food insecurity can increase the risk for chronic disease. It can also make managing chronic conditions so much harder for our neighbors who are already dealing with a lot of stressors in their life. And also, chronic conditions can increase the risk for food insecurity because of increased medical bills, and inability to work consistently. I think as a food bank, we are in a very unique position to be able to address both those hunger and health concerns through the foods that we provide. Right. So it paints a big picture that we have two dietitians on staff, as you mentioned, right, so that we can really hone in on, where are we at currently with the foods we're providing and how can we increase the nutritional value to prevent and manage conditions in our community and just really be a responsible food provider.
It's important, I think, that we reach our neighbors and we can inform them in terms of meal planning and cooking and food safety and so on. Mm-hmm. And you and your team have done a great job launching Nutrition Hub on our website so that anytime they need that information, they're not limited to the hours a pantry is open. They really can access that information anytime. But can you tell us a bit about Nutrition Hub, including the cross-cultural parts of it?
This has been a really exciting resource we've been working on for a while. So we have one central place for anything from healthy recipes to cooking videos to activity sheets for kids and just general education around the benefits of nutrition and how a family or an individual could take maybe the foods they're receiving from our food pantry or our home delivery service or they're purchasing with their SNAP dollars and turn that into a balanced meal for their family, just to promote good health and good family memories in cooking together. So on our Nutrition Hub website, all of the recipes are very simple, very fast, so that they're approachable for our neighbors.
I really appreciate that. The content of Nutrition Hub, but also the way you've worked with ND Hunger Network on the Cooking Matters classes, mm-hmm, so it's kept basic and practical and tied to the food that we will be offering them.
Right.
Is there anything you would offer or add on those programs?
So yes, you're absolutely right. Keeping it simple is very important. So whatever we can do to make nutrition accessible and approachable to our neighbors is exactly what we're shooting for. And as you mentioned, different cultural needs are very important to consider. We've been working with the Immigrant Welcome Center here in Indianapolis to really understand the needs and the preferences of our neighbors who are coming from different countries for a variety of reasons. Sometimes the foods that are traditionally offered at food pantries may be unfamiliar to a family. Right. So if we can, one, change the mix of foods we're providing to meet those different needs and preferences, and then two, provide some really simple education on, hey, if this food is unfamiliar to you, here's a simple way you can prepare it at home.
Right. And you touched on another important point, really. We often talk about feeding the line, mm-hmm, but we can't really be satisfied at making progress in reducing that line and closing the meal gap if we don't have confidence we know all of the neighbors across our 21 counties, mm-hmm, who need our help and need our support. If you could share with the audience what might help us fully reach the needs of 21 counties, if you could have support and more partnership and additional resources and really close the meal gap and keep it closed and drive nutrition themes across 21 counties, what would it take? What else do you need?
So I would say we have a lot of amazing, wonderful partners in each of our 21 counties right now. And so just expanding their capacity to provide more nutritious foods,
Right.
to bring nutrition education to their pantry or their community center or their place of worship, so that we can replicate what we're doing here at Gleaners and learn from other partners that are already doing great works. We don't have to, reinvent the wheel,
Right.
but we can partner more with things like Purdue Extension, who are offering nutrition education programs in the community. We can provide trainings to food pantry staff to help them rearrange their pantry so that healthy, nutritious foods are the first thing that neighbors see when they walk in.
Right.
So lots of ways that we can partner together and kind of expand our impact.
Right. And we're involved in some really interesting partnerships with hospitals and healthcare providers. Is there anything you would add about those partnerships and what it means for the neighbors that we and those partners serve?
Right. Yes, healthcare partnerships have been instrumental to reaching the population we would like to serve, and also helping those clinics or those hospitals become a place where patients can get connected to the food resources that they need. I do monthly trainings with medical providers and students to help educate them on the issue of food insecurity, how prevalent it is, and how it really impacts the health of their patients, and then practical resources they can refer their patients to. So if we can make it easy for an individual who's already going to visit their doctor, can we also provide food in that visit so they're saving time and energy, not having to visit a lot of different social service stops?
You're doing work around educating that next generation of dietitians through IU and Purdue, and that next generation of doctors through IU Medical Center and others. We're also doing things through Nutrition Hub to educate the neighbors we serve. Really, this education theme, I think, is critical to solving this food insecurity and chronic health condition issues over the next generation. Is there anything you would add to that sort of summary of why we're doing this, and or resources that you might need to get more of that done?
I just want to reiterate what you said. It's the importance of providing the resources, so the healthy food, the connections to other services, and that education, so our neighbors know what to do with those resources and have the capacity to use them to the best of their ability. So I just welcome anyone who has interest or passion or talent in this space of either food insecurity, nutrition, or health. I would be happy to work with them to see how we can expand the partnerships we've already been working on, the work we've already been doing here at Gleaners to improve the nutritional quality of our foods, and then also the education we've been providing to the community. I would love to work with donors, volunteers, community partners to help expand that impact.
Well, Sarah, thank you for joining me. I love that we can make a difference through the foods that we provide in not just food insecurity, but chronic health conditions. And as you indicated, it will take more resources. This is more complex. Certainly, to have an ample supply and variety of healthy, nutritious produce and dairy and other items, it's more expensive than the old model of food banking, but it's worth it, and I think it's the right thing to do. We're learning more information with our healthcare partners, and I think that bodes well for long-term impact. So thank you for helping me share the story today.
Thank you very much. Thanks for your leadership.